Welcome to another Ultrasound of the Week. I'm Dr. Michael Schick. Thank you so much, Jim Holmes and Trevor Henneveld, for this amazing clip. Let's get right into it. Now, Jim and Trevor had a single-digit aged child come into the pediatric emergency department complaining of a few days of a growing mass underneath his mandible along his superior anterior part of the neck. And that's pretty much what they found on physical exam. Overall, the patient looked pretty well. Now, it was relatively large, it was unilateral, but it did not appear as a typical lymph node would, as a typical simple cyst might, and they weren't sure exactly what this diagnosis was. Here's what the ultrasound showed. Here we are in the soft tissue of the neck. The tissue at the very top of the image, or the most superficial tissue, appears pretty normal. No evidence of cellulitis or cobblestoning. You have sort of fascia, muscle layers. And then you have this sort of expansive tissue underneath that, sitting right on top of a couple blood vessels. That's our thing of interest, the thing that is pathologic. Below that also appears like normal soft tissue. Our tissue of interest here has some mixed echogenicity within it, which makes me think it's an edematous structure. But the most interesting thing is that it has these multiple circles that are anechoic within it, which are probably cysts just from the appearance of them because they look like simple circles, well demarcated. They don't have these raggedy borders that make you think it's an abscess. One other thing to think about whenever you see an anechoic circle is this a vascular structure, vein or artery? So you got to put color on it to make sure it doesn't have flow. And in fact, they did this, and there's no flow within these cystic structures, but there's a lot of flow around them. Again, speaking to this as a edematous or inflammatory tissue. The tissue almost has this cluster of grapes appearance, and there is tissue within your neck that takes on this classic appearance when it's swollen or inflamed or infected. And that's the glandular tissue within your neck, the largest of which is the parotid gland, which fits with this patient's presentation and anatomical location. A normal parotid gland in a pediatric patient can be difficult to visualize on ultrasound, difficult to palpate on physical exam. And here's the patient's normal side on ultrasound. You can barely even see that tissue. But when inflamed, it becomes pretty obvious and has this classic appearance. This is very helpful because it doesn't completely rule out the other etiologies you might be thinking about, like a bacterial infection, a mass, but it really reduces those possibilities because you can see on ultrasound that this is an inflamed and large parotid gland, and most likely that's the diagnosis, and the patient looks really well. It's likely a viral etiology. So the diagnosis here is acute parotitis, and this patient is most likely viral, but there are multiple other etiologies of parotitis. Both children and adults can have bacterial parotitis, and that requires antibiotics, and particularly neonates. There's only been 32 case reports, but if a neonate comes in and you think they have parotitis, then that is usually a life-threatening illness that needs gentamicin, ampicillin right away. You can get chronic bacterial peritonitis as well. Remember, mumps disease, one of the most common causes of viral parotitis, especially those who are not vaccinated or under-vaccinated. And they can have a lot of complications. They're rare, but you can have meningeal encephalitis, pancreatitis, orchitis, and deafness as well. So remember, think about all those things. HIV can do this as well, both in children and adults. And then one other illness to think about, or infectious disease rather, is tuberculosis can present as parotitis. And the last one I'll mention right now are autoimmune illnesses. A whole host of these can cause inflammation of your glandular tissues, but the most common one would be Sjogren's. So antibiotics for those that you think are bacterial. Admit the patients that have signs of systemic illness or just appear ill. And for the ones that you think are viral and can follow closely with their pediatrician, they can probably go home.